Welcome to BLR training. Bipolar disorder is a mental illness characterized by periods of extremely elevated mood called mania, followed by periods of severe depression. While everyone may feel moody from time to time, people with bipolar disorder feel mood swings that are much more severe than the average person, enough so that home and work life may be greatly affected. As a supervisor, you may be faced with an employee or an applicant who has bipolar disorder. This training session will give you the information you need to be able to effectively deal with employees with bipolar disorder, and also understand the legal ramifications as they apply to the workplace.
Hi, I'm Laura Piper, licensed clinical social worker. Every day, I work with all types of people, many of whom struggle with mental health issues in the workplace. During this training, I'll be talking about ways you as a supervisor can help your employees who may have mental illness. The main objective of this particular session is to help you understand what bipolar disorder is and how you can help employees who are dealing with it. By the end of the session, you will be able to understand what bipolar disorder is, know the causes and symptoms, understand how it can affect work, know what the law says, and learn how to manage employees with bipolar disorder.
Before we begin the session, let's take a few minutes to see how much you already know about bipolar disorder. When you're ready to begin, select Next. Select True or False. Then Submit.
Bipolar disorder is a brain disorder characterized by periods of an elevated mood called mania. It is followed by long periods of sadness and hopelessness called depression. The mood shifts are severe, more so than for an average person who sometimes feels moody. More than 6 million American adults suffer with bipolar disorder. The exact cause of bipolar disorder is not really known, but it can run in families. Treatment can help and usually involves a combination of medicine and counseling. Because bipolar disorder is a mental illness, there is often a stigma attached to having the disease. Therefore, many people try to hide their symptoms and do not seek treatment. Now let's hear more from Laura Piper.
Bipolar disorder is a chronic mental illness. People with bipolar disorder have mood states that swing from what we refer to as manic episodes to depressed states that last anywhere from days to a week to several weeks. When someone is in a manic state, they can have rapid speech, have an abundance of energy, and have little need for sleep. They can be highly sexual, spend money recklessly. This is followed by a depressed state where people have trouble functioning. They will appear tired, have trouble focusing, and have a pessimistic outlook. Bipolar disorder can develop as a result of specific brain chemistry, and there's a genetic component to bipolar also, so it does run in families.
As we mentioned, bipolar disorder involves periods of mania. Select the forward and backward arrows to learn more. Inflated self-esteem. Decreased need for sleep. More talkative than normal. Easily distracted. And involvement in risky behaviors such as excessive spending, sexual indiscretions, or drug use. Now let's take a look at the other end of the spectrum, what a person who is in the depression phase of bipolar disorder might experience. Select the forward and backward arrows to learn more. Feelings of hopelessness, worthlessness, or pessimism. Loss of interest in activities. Significant weight loss or gain. Insomnia or hypersomnia, which is sleeping too much. Fatigue. Difficulty concentrating. And suicidal thoughts.
Surveys show that 9 of every 10 people, or 90%, who suffer from bipolar disorder, say the illness affects their work performance. Because the workplace can sometimes be a place of stress and unpredictable challenges, bipolar disorder sufferers may have an even tougher time managing. And because the symptoms of bipolar disorder are different depending on whether an employee is in the mania or depression stage, it may be hard to tell if an employee has bipolar disorder or is just inconsistent or unreliable. Employees with bipolar disorder may start a project with great vigor and energy. And once the depression phase kicks in, you may see significantly decreased productivity, lack of cooperation, safety risks or accidents, and absenteeism. Remember, it is not your job to diagnose any employee. However, if you notice behaviors that affect job performance, you should have a direct discussion with the employee. You may recommend that the employee contact your company Employee Assistance Program, or EAP, to help with the poor work performance.
The most effective treatment for bipolar disorder is a combination of therapy and medication management. Being consistent with treatment is the key to staying well. When thinking about bipolar disorder and your employee, it is never appropriate to diagnose. It may help to start a dialogue about how their behavior affects their work and coworkers. EAP programs can refer the employee to specific therapists who specialize in treating bipolar disorder.
Now, it's time to see how much you are learning from the information presented so far. When you're ready to begin, select Next. Select the correct option, then Submit. Now, it's time to ask yourself if you understand the information presented so far. For example, do you understand what we've said about what bipolar disorder is, the symptoms of the mania and depression phases, and what effects you may see in the workplace from an employee with bipolar disorder? It is important that you understand this information so you will be able to deal effectively with an employee with bipolar disorder. Next, we'll take a look at what the law says and steps you should take if one of your employees is dealing with bipolar disorder.
There are several laws that were created to assist people who have certain disabilities, including mental illness, in the workplace. One of those laws is the Americans with Disabilities Act, or ADA. The ADA prohibits employers from treating an applicant or employee unfavorably because they have a disability or because the employer believes they have a disability. In terms of how this relates to bipolar disorder, it means that if you as a supervisor know that an applicant or an employee has bipolar disorder, or if the employee or applicant was previously diagnosed with bipolar disorder, or even if you simply think they have bipolar disorder, you may not refuse to hire that person or treat them poorly because of the bipolar disorder. Harass or retaliate against an employee who has bipolar disorder.
To accommodate an employee with bipolar disorder, it is helpful to find out as much information about what limitations may be experienced. Select the forward and backward arrows to find out what questions might be helpful to ask the employee.
What exactly are the limitations you are experiencing at work?
How do these limitations affect your job?
Which job tasks are the most problematic because of your limitations?
What ideas do you have to help with your limitations at work? Once you determine the answers to these questions, you can better help the employee make changes that will be better for everyone involved. You do not have to accommodate every request that an employee makes. For example, if the employee states that the workload be cut in half, but the pay rate remain the same, this is referred to as undue hardship. However, there are many things you can do to help an employee with bipolar disorder cope in the workplace, with, for example, maintaining concentration and stamina, or staying organized and getting along with coworkers. For example, allowing flexible scheduling or work-at-home time, providing frequent or longer breaks, allowing time off for counseling or doctor's appointments, reducing distractions in the work area, providing white noise, increasing lighting, dividing large assignments into smaller ones, reminding the employee of deadlines, providing positive reinforcement, and developing strategies to deal with problems as they arise. The Family and Medical Leave Act, or FMLA, is another option for employees suffering from bipolar disorder. This law allows certain employees who meet eligibility requirements to take up to 12 weeks of unpaid time off work while still maintaining their workplace benefits. This law has many eligibility requirements, and also some states have different requirements. You should be sure you understand the full scope of your state's FMLA laws before granting any leave. In general, employees may request leave to care for their own serious health condition. Leave may be intermittent if both you and the employee agree. You may require the employee to provide medical certification. The FMLA provides a general definition of serious health condition that includes chronic conditions, conditions requiring multiple treatments, and conditions necessitating 3 or more days of missed work. This may include bipolar disorder.
Now it's time to see how much you've learned about dealing with bipolar disorder in the workplace. When you're ready to begin, select Next.
Select True or False, then Submit.
Let's take a moment now to make sure you understand the information presented during this training session. Do you understand what we've said about what bipolar disorder is and who can get it? What the symptoms are? How bipolar disorder can have an impact on the workplace? What the law says about bipolar disorder, especially in relation to the FMLA and the ADA? And what reasonable accommodations may help you manage employees with bipolar disorder? It's important to understand all this information so that you can effectively manage employees who are dealing with bipolar disorder. Let's now finish up with a few key points to remember. The key points to remember about this training session are: bipolar disorder is a serious mental illness that causes people to have severe mood swings. Bipolar disorder can have many symptoms that can affect an employee's effectiveness at work. ADA and FMLA laws may apply to employees who suffer from bipolar disorder. As a supervisor, it's important that you know about bipolar disorder and the tools you can use to help employees who may suffer from bipolar disorder. This concludes the training session on bipolar disorder. Please be sure to go back and review any information that is not completely clear. If you still have questions, ask your supervisor or trainer.
You will now be tested on the material covered in this course. To take the final quiz, first close this window and then select the Take Quiz button at the top of the screen.